Hi, Part 3 in the Normal Aging versus Dementia unit will be on conditions related to aging. Now that you have heard about normal aging and about dementia, it is important for you as a caregiver to know about conditions related to aging and how they also make a difference in the physical and mental abilities of the resident. Conditions related to aging will be discussed by myself, Millie Bierman, and we welcome back Jan Navin, AWCTC nursing instructor. Now please turn off the videotape and turn to Part 3, Conditions Related to Aging, pre-test in your workbook. See you soon. Hi Jan, happy to have you back.
Thanks, Millie.
Today we're going to discuss conditions related to aging. Many conditions result from normal aging, while others come from an ongoing health problem that developed earlier in life. Jan, what are some of the things that influence conditions related to aging that might have occurred earlier in their life?
Many of the conditions that impact aging are conditions that we're familiar with, that we have talked about in other parts of the presentations. Improper diet, lack of exercise, overweight, smoking, misuse of alcohol or other drugs, overuse of stimulants, and that would be caffeine, soda, chocolate, accidents, environmental pollution, stress, mental health problems, emotional problems, or other health conditions.
Well, as we know, many residents will come to the CBRF with 1, 2, or 3 conditions, maybe none at all, or they may develop 1, 2, 3 more conditions when they're at the CBRF. This part of the unit, we're going to talk about conditions that are related to aging, and for each condition we will identify signs and symptoms, medical treatment by an MD, and important things to remember when caring for residents with these conditions. As we talked about before in Part 1, as a caregiver you will get to know each resident, and you will know what is normal and not normal for them. It is very important for a caregiver to report to the person in charge of the CBRF. That could be a manager, a nurse, or another caregiver, what they see in the way of signs and symptoms, so that those things can be taken care of and discovered. It's invaluable to that person in charge to have that done, so that they can take care of the needs that the person might have. Also, if a resident refuses medications or treatments, that's important that that be told to the person in charge. If you do that as a caregiver, you know, then that might help the person from even getting a condition if it's noticed earlier, or having it even become worse than what it is. And it will ensure a healthier lifestyle for that individual at the CBRF, and will allow them to stay in the CBRF longer. Jan, what are some of the comfort measures that a caregiver may need to provide to the resident at the CBRF?
Many of the comfort measures a resident may need are measures that would occur to you through common sense, to keep the resident warm and dry, to assist them with comfortable positioning, whether they're lying in bed or seated, make sure they wear comfortable clothing and footwear, maintain their cleanliness and hygiene, provide emotional and spiritual support as necessary, ensure that they have adequate rest, provide adequate intake and output, and to provide regular exercise and activities for them.
Mm-hmm. In caring for the dementia resident, the caregiver may need to do what kinds of things, Jan?
Well, that caregiver is going to need increased patience and understanding. Even though the person has dementia, they need added reassurance. They need some diversion if their behavior is agitated or uncooperative. And sometimes we can't accomplish what we want to do right now. We have to leave and come back and try a different approach to get some cares done. One of the things that's important is to realize that the person with dementia is not confused in the same way every day. I'd like to share with you one of my experiences with a client with dementia. And this woman's name was Molly. And Molly was in a locked unit because she had dementia. And she was a very busy woman. She was pretty agitated and very busy. And as I was going through the unit one day, I noticed that she had on her windowsill a whole collection of African violets, different colors that were blooming beautifully. And Molly was in her room. So I said to her, Molly, how do you get those flowers to bloom so beautifully? I can't get them to bloom. Well, she said, I talked to them. And I said to her, knowing that she had dementia, tell me what you say to the flowers. And she walked over to the windowsill and shook her finger at those violets and said, I just tell them, you're just like I am. You've gotten yourself into a place you can't get out of, so we'll just have to bloom right here.
Wow.
And at the end of that experience, I wondered who should leave the locked unit and who should stay, because she obviously had some knowledge and some awareness that we had not given her credit for having.
Mm-hmm. In caring for the dementia resident, the caregiver may need to have increased patience and understanding, provide added reassurance, provide diversion if the resident is agitated or uncooperative. Just say to the resident when they're agitated, perhaps, oh, look out the window at the bird or something, and they'll soon forget. Return and reattempt specific cares if necessary with a different approach. And realize that the mind may react normally at times, as you have said. A dementia resident with any condition related to aging may have what, Jan?
Dementia with any other medical condition may exhibit itself more strongly. So there may be increased confusion and disorientation, might be uncooperative when receiving any meds and treatments that the other condition require, have increased changes in the emotions and behaviors, or need extra safety precautions taken in their environment.
Mm-hmm. Mm-hmm. We're going to talk about conditions now more specific, and one of them is cataracts, and many elderly people have cataracts, and it's a thick, hard film of cloudiness that forms on the lens of the eye. And cataracts may be present at birth at times, but very seldom. Most common form of cataracts occurs at the age of 70 or older. When a resident has a cataract, it appears to them as though they're in a smoke-filled room. So some of the signs and symptoms of cataracts are the gradual loss of vision. Eyes appear to have that cloudy, milky coating on them, similar to the smoke-filled room. You are going to notice that. Jan, what is the medical treatment that a doctor might order?
The medical treatment now generally is the removal of that cloudy lens. That will be done when that cloudiness or disturbed vision causes difficulty for the client. We used to hear that you would wait until the cataract was ripe before it would be removed, and that isn't so commonly done. After the removal of that lens, there well might be a lens implanted right into the eye, which would be a permanent process. That isn't always done, however, so that client might wear a contact lens or might not have a lens implanted at all and might wear eyeglasses that are fitted particularly to meet the deficits in vision that they would have as a result of that lens removal. Multiple eye drops before and after surgery are pretty standard. An eye shield to prevent irritation or scratching would be worn at night for probably about a week, not much longer than that anymore. And sunglasses, the wraparound ones, anytime there's any daylight, sunlight, are necessary to protect that eye post-operatively.
Mm-hmm. In caring for the resident with cataracts, it is important to report the following changes to the person in charge at the CBRF: impaired vision, scratchiness, irritation of the eye, assist the resident with ADLs as needed but allow them to do what they are able to, administer prescribed eye drops as per MD order, follow before and after surgery care as per doctor's order, prevent any straining, that is bending over or with constipation. Remind residents not to touch or rub their eyes. The next condition we're going to talk about is also with the eyes, and that's glaucoma. Glaucoma is an increase in the pressure of the fluid of the eyes. When a resident has glaucoma, there are a few signs or symptoms in the very early stages. Without treatment, glaucoma can cause blindness. What are some of the signs and symptoms of glaucoma, Jan?
The client often will demonstrate or request frequent changes of eyeglasses. They'll be going to the doctor to say, I need my glasses changed because I don't see as well. There also might be a headache, a blurred vision, tired eyes, I think, is one of the things that they express. Spots appearing before the eyes, a halo of color around lights at night, and a reduction in their ability to see at night. That's chronic glaucoma. There is an acute angle glaucoma, which the only symptom or the main symptom is severe pain in the eye, and that's an emergency and it must be taken care of immediately. They must immediately get to medical help.
That's right. And the medical treatment for glaucoma by an MD may include the use of prescribed eye drops to regulate eye pressure, and the use of special sunglasses, special ones, or again, the wraparound are very good, and eye patches. In caring for the resident with glaucoma, it is important to report the following changes to the person in charge at the CBRF. Any vision changes: headache, eye tiredness or pain, seeing spots or colored halos around lights at night, inability to see at night. Again, assist the resident with ADLs as needed, but allow them to do what they are able to. Administer prescribed eye drops as per doctor's order, and use any eyeglasses and eye patches as per doctor's order. Now we're going to talk about another condition that we see in the elderly eyes, and especially in the elderly, and that's macular degeneration. And that's the damage or breakdown of the arteries in the eye. And the resident with macular degeneration will see a growing blind spot in the middle of their eye, in the middle of their vision, and they will see details less clearly. And I think it's somewhat like putting a quarter up to your eye, and then you see the light around the edges, and you can see to the side, but not straight ahead. What are some of the signs and symptoms of macular degeneration, Jan, and what is the medical treatment?
You just described the main one, the loss of the center of the vision. Vision becomes blurred, and the sensitivity to bright light. I think it's important to remember that the peripheral vision may be very good, and the person can compensate for that sometimes by learning to turn their head so that their peripheral vision is what they're using. The medical treatment may be laser surgery for some forms of macular degeneration. However, not every form can be helped by that. The use of special sunglasses and or eye patches, and sometimes some additional lighting pieces. A low vision clinic might give you assistance with some magnification or some kinds of lamps to prevent glare.
In caring for the resident with macular degeneration, it is important to report the following changes to the person in charge at the CBRF. Loss of vision in the middle of the vision field, blurred vision, and sensitivity to bright light. Assist the resident with ADLs as needed, but allow them to do what they are able to. Use eyeglasses or eye patches as prescribed by the doctor, and follow before and after surgery care as per doctor's order.
Another thing that's helpful if they do is to remind the person with macular degeneration of grooming discrepancies, if their clothing is spotted and they can't see it, or if makeup isn't applied appropriately, so that you can help them with keep their grooming at a level that they would like it to be.
Right. And generally, in caring for the resident with any condition of the eye, it is important to maintain a safe environment. To maintain a safe environment, remove clutter from all living areas, have night lights in hard-to-see areas, have sufficient lighting in all areas, prevent glare by pulling shades using non-glare lighting and non-wax surfaces, clearly mark stairs and remind residents to use handrails, remove all throw rugs, make sure all thresholds do not cause tripping, and keep commonly used objects within residents' reach, but out of the reach of other residents. Now we will go on to another condition that's very, very common in the elderly, and that's arthritis. And that causes pain and swelling of the joints. What else do you notice in the resident with arthritis, Jan?
The signs and symptoms that you're going to notice in a resident with arthritis are bent, knobby, or deformed joints, usually this first one in the fingers. They will talk about pain or muscle spasms and cramps that are particularly impacted in cold weather. Heat or swelling of joints, the joints might even appear red and a little bit swollen, and changes in the ability to move about. I think pain is probably the most common one that they describe.
And most generally, arthritis appears in the spine, the knees, the hips, and the fingers.
Yes.
Is where we notice it the most. What is the medical treatment for arthritis that a doctor might order?
The most common kind of arthritis, osteoarthritis, ordinarily would have some medication to reduce some inflammation, some swelling, and to relieve pain. Warm baths, a use of a heating pad, providing it is an auto temperature shutoff type, and that really is the one that must be used, otherwise there could be some serious burns as a result of the heating pad. Warm wax treatments might be used. A joint warmer, which is a soft cloth that is worn over the joint to keep it warm. Splints and braces are sometimes prescribed, and they should only use the ones that are prescribed for them. Prescribed walking devices that are fitted to them, a cane or a walker. Adequate rest, and rest periods is very important. That person with arthritis cannot become overtired, then their pain is going to be worse. Regular activity and exercise program without pain, and a weight loss for individuals who are overweight.
Important. In caring for the resident with arthritis, it is important to report the following changes to the person in charge at the CBRF. Pain, muscle spasms and cramps, heat or swelling of joints, changes in the ability to move about. Assist the resident with ADLs as needed, but allow them to do what they are able to. Administer medications as per MD order. Provide a regular exercise activity program as tolerated. Provide adequate rest and rest periods. And provide assistance when requested or needed for warm baths, heating pad, wax treatments, joint warmers, splints or braces, and walking devices such as canes and walkers, and a diet restriction for the weight loss. Now we're going to go to heart conditions. Heart conditions are not a part of normal aging. The things that contribute to heart conditions are a diet, and that would be low fat or low cholesterol, exercise, overweight, smoking, stress, overuse of stimulants, environmental pollution, and other health conditions. Some common heart conditions related to aging are congestive heart failure, for one. Jan, could you tell us a little bit about that?
In order to understand some of the heart conditions, we have to remember that the heart is a muscle pump. And as it becomes less efficient, the body is going to respond in different ways. Congestive heart failure affects different people in different ways. One person may have it and be able to go about their business as usual, and another person might be seriously ill. A resident with congestive heart failure may have an increased amount of anxiety, may be very concerned about their condition, may need frequent reassurance and comfort measures.
So there's acute congestive heart failure that comes on very suddenly, and the slow or the chronic congestive heart failure that a person might have had for quite a while. And noting the signs and symptoms then will keep you alert on and not getting any worse.
Yes.
And the signs and symptoms of congestive heart failure are quite a few, Jan. Could you name some of them, please?
Shortness of breath is probably the most common one that patients will speak of and that you will observe. Sometimes if a person's been short of breath for a long period of time, they don't realize how short of breath they are. And so your observation will be able to see whether or not there's been an increase in that. There may be a slight cough, probably weakness, and the person becomes tired quite easily. Swelling of the arms, hands, legs, and feet, often with a reddish, purpley color of the arms, hands, legs, and feet. Temperature changes of the extremities, they're usually cooler than the rest of the body. The restlessness and anxiety and confusion will tell you their condition is worsening. Pain on breathing, an increase in blood pressure, an increase in pulse. A weight gain, which is from the edema. It isn't because they're eating too much, it's the edema is going to increase their weight. Nausea and vomiting, and a loss of appetite.
The medical treatment for congestive heart failure by a doctor may include administering medication as the doctor orders, Diet restriction. Watching the salt intake is really very important. Regular exercise and activity to tolerance as the doctor orders. Rest again with, intermittent rest with activity per doctor's order. Oxygen in some cases as the doctor orders. And support hose, TEDs we call them. The doctor will order them. It's much easier to put those on when the person is lying in bed. It's easier for you to get them on, and it's easier for the person that you're putting them on. It's not quite as much of a struggle to do that.
And when you put them on when they're lying down, it keeps some of the swelling from forming. And that's the point of using them. So they really should be put on when that patient is lying down.
And then you elevate the legs and the feet, and that's especially important during the day. Sitting in a chair, that doesn't mean necessarily lying in bed and putting them up on pillows. It's sitting in a chair, putting them up on a footstool that isn't too high. Regular blood pressure and pulse checks as per doctor's order. And then daily weights may be ordered by the doctor, or at least frequent weights. In caring for the resident with congestive heart failure, it is important to report the following new problems or changes to the person in charge at the CBRF. Shortness of breath or increase in shortness of breath, or SOB. Slight cough or if cough worsens. Easily tired or weakness. Edema, which is swelling of the arms, hands, legs, or feet. Discoloration of the arms, hands, legs, or feet. Temperature changes in the arms, hands, legs, or feet. Chest pain, pain on breathing, increase in blood pressure or pulse, sudden weight gain, nausea or vomiting, and loss of appetite. Again, assist the resident with ADLs as needed, but allow them to do what they are able to. Administer medications as per doctor's order. Provide prescribed diet as per doctor's order. Provide a regular exercise activity program as tolerated. Provide adequate rest and rest periods. Provide comfort measures when the resident is anxious. Maintain regular blood pressures, pulse, and weight checks and record. Provide oxygen if the doctor orders that. Elevate legs and feet and use support hose as the doctor orders, and treat any open areas.
It's important with that oxygen too to check it periodically to make sure it's set on the value it should be set on, that it doesn't sometimes get bumped, or the resident might have changed it, or another resident might have thought that was an interesting dial and just turned it.
True. It should be as the doctor orders. It's very important. Next, we're going to talk about high blood pressure or hypertension. High blood pressure can lead to more serious conditions. If blood pressure remains elevated for a long period of time, it can cause heart disease, strokes, and some other damage. When people show signs and symptoms of hypertension while others show none, rather some people show signs and symptoms. The signs and symptoms of hypertension are what, Jan?
The most commonly described signs and symptoms of hypertension are tiredness, headache, dizziness. Sometimes you can see a reddened color of the face and the neck. The client might describe ringing in the ears, anxiety. That often is, particularly with heart conditions, the patient might seem more restless and more anxious and express some fear about the way they feel. Impaired memory, confusion. There may be some nosebleeds and an awareness that their heart is pounding very hard. They will tell you, I can feel my heart pounding.
Mm-hmm. And what might the doctor order for these things?
Most common treatment, the first step in most treatments is to do exercise and diet prescriptions to try to have the patient be regulated without medication. However, medications to reduce the blood pressure are also used. There will need to be regular blood pressure checks, diet restrictions, usually of salt, very likely fat also, weight reduction. A regular exercise program is extremely important in the treatment of high blood pressure. Avoid stimulants, caffeine, coffee, Coke, chocolate. Stop smoking. Limit alcohol intake. Reduce stress, and that's easier for some people than for others, and to have adequate rest and relaxation.
It's a known fact that just a few pounds loss of weight can bring a blood pressure down.
Yes, it can.
In caring for the resident with hypertension, it is important to report the following changes to the person in charge at the CBRF: tiredness, headache, dizziness, reddened face or neck area, ringing in the ears, anxiety or fear, impaired memory, confusion, nosebleeds, and awareness of that heart pounding very hard. Assist the resident with ADLs as needed, but allow them to do what they are able to. Administer medications as doctor orders, and provide diet as doctor orders. Provide a regular exercise activity program as tolerated. Provide adequate rest and rest periods. Provide quiet, calming environment. Reduce stress. Maintain regular blood pressure and weight checks and records. Limit smoking and alcohol intake. Next, we're going to talk about the CVA, cerebral vascular accident, or stroke. And that is a sudden stopping of the blood flow to the brain that causes brain damage. Many people that have a CVA are successfully rehabilitated. However, in some people, it does cause death. Some of the signs and symptoms of a CVA or stroke are what, Jan?
A person who is having a CVA or a stroke very commonly will have a headache, dizziness, might have some confusion and some memory loss, a loss of speech or a blurring of speech, a blurred vision or a change in vision, and the change might be a part of the vision in one eye or both eyes the same, the right side of both fields of vision. Weakness or an inability to move a part of the body, a drooping of one side of the face, usually on the same side as the inability to move an arm or a leg, a loss of bladder or bowel control, difficulty swallowing, some seizures, loss of consciousness, usually an increase in blood pressure initially, and a slowed pulse.
And sometimes a resident might just fall for no reason. It's worthwhile checking into why that happened.
Yes.
What is the medical treatment for cerebral vascular accident or stroke, Jan?
The immediate hospitalization is required for a stroke, and so a call to 911 from a CBRF would be appropriate. Oxygen is something that will be used immediately. Medications, rehabilitation, physical therapy, speech therapy, or occupational therapy to assist the resident to relearn how to take care of themselves and to be as independent as possible.
And speech therapy also includes swallowing?
Yes. They will monitor the swallowing, and they are the ones who can usually tell you whether that client has to have pureed food or thickened liquids or a soft diet. They will do the diet prescription. They will also tell you when that client is ready to eat independently or whether they have to have someone with them to remind them to swallow.
In caring for the resident with a cerebral vascular accident, it is important to report the following changes to the person in charge at the CBRF. Follow the emergency procedures and policies as per individual CBRF. After hospitalization rehabilitation, the care may include assist the resident with ADLs as needed, but allow them to do what they are able to. Administer the medication as the doctor orders. Provide the diet that the doctor orders. Provide a regular exercise activity program as tolerated. Follow the MD orders for therapy programs that we talked about that are so important. Provide adequate rest and rest periods. Encourage regular position changes from sitting to standing, lying to sitting. Maintain good skin care. Assist resident with all assistive rehabilitation devices or equipment, such as canes and walkers, braces, splints, cups, bowls, the enlarged spoon or fork, handles, and a plate guard is very helpful to these people so they don't shove the food off the plate. The next condition we're going to talk about is diabetes, and diabetes is something that we see in quite a few people, residents probably in the CBRF or elderly. And that's a disorder of the pancreas that causes improper use of the body's sugars or carbohydrates. And the carbohydrates really include sugars, bread, potato, pasta, that kind of thing. The pancreas produces insulin, and insulin controls the sugars in the body. In the diabetic, there is not a healthy balance between the insulin production and how it's used in the body. Some of the signs and symptoms of diabetes include what, Jan?
The three most commonly noted symptoms are excessive thirst, excessive hunger, and frequent urination. Those are three that they're called the three cardinal symptoms of diabetes. There also will be weakness and dizziness and maybe a sudden weight loss. Very commonly there's irritability and itchy skin, a fruit odor of the breath and the urine, excessive perspiring, change in vision, and that often triggers the first doctor's intervention, that the client thinks they need their glasses changed again. Mm-hmm. Wounds or sores that don't heal, and that's a very important symptom, and moist, clammy skin.
And what might the doctor order for treatment of diabetes?
The doctor may require that the patient be hospitalized until that evaluation and the balance between the amount of insulin or other medication that the patient needs to take and the diet and the exercise is calculated. A diabetic diet, which is a calorie count, it will be, you'll know that it's an 1,800 or a 2,000 calorie diet, but it also specifies how many servings of which kind of food per day. Mm-hmm. Regular blood sugar checks, and those usually are a finger stick that can be done in the CBRF. It's important when you do those, because this is an elderly population, that the stick is made around the edges of the fingers. For one thing, it's less painful.
Yes.
And because they have so many of them, we need to be careful of we talked in one of the other sessions about the fragility of the skin and the loss of muscle and the loss of fat tissue. So if we go around the edges, it isn't as painful and it doesn't seem to cause as much trouble as if you do the stick right in the middle.
Right. In caring for the resident with diabetes, it is important to report the following changes to the person in charge at the CBRF: excessive thirst, excessive hunger, frequent urination, weakness, dizziness, sudden weight loss, irritability, itchy skin, fruit odor of breath and urine, excessive sweating, changes in vision, loss of consciousness, changes in blood sugar checks, swelling, redness, drainage, or open area of the skin, a wound that does not heal, restlessness, anxiety, moist, clammy skin, leg or feet pain is very common in diabetic people. Assist the resident with ADLs as needed, but allow them to do what they are able to. Administer medication as the doctor orders and on time. Check blood sugars as doctor orders. Provide diet as per doctor order. Provide a regular exercise activity program as tolerated, and provide adequate rest and rest periods. Give good skin care. Do not cut fingernails or toenails. Refer to a podiatrist, which is a foot doctor. Make sure footwear fits properly. Keep hands and feet protected and warm, and eat meals and in-between snacks on time.
It's important, too, to remind families not to bring favorite treats and candy and cookies and things in for the diabetic client, mm-hmm. because they may not have those unless they're worked into their diet.
True, happens often. Next, we're going to talk about Parkinson's syndrome. And Parkinson's syndrome is caused by a lack of a chemical called dopamine that is normally found in the brain. Parkinson's syndrome is a disease of the nervous system, and each resident with Parkinson's syndrome will have varying degrees of the symptoms. Some residents will become worse very gradually, and others will become worse quickly. The signs and symptoms of Parkinson's syndrome are pretty easy to identify, actually, some of them. Could you tell us about them, Jan?
Parkinson's is very hard to have. It's progressive and it's relentless. It just moves along, and regardless of what the client does, the Parkinson's is not going to go away. So they need caregivers who have a lot of patience and understanding to help them. Tremors are probably the first sign. Tremors of the hands usually is what we see. Tightness of muscles, a stooped posture, a shuffling walk, difficulty in starting to walk, and a difficulty in stopping to walk. They might walk right into something before they could stop. drooling, loss of bladder control, difficulty swallowing, a slurred speech, a monotone speech, and a mask-like face. There's almost no reaction to the face. It just seems very unemotional as a result of their Parkinson's. Balance and coordination problems, an increase in appetite perhaps at the beginning particularly, emotional ups and downs, and a very oily, moist skin.
It's really, really important to maintain their dignity. When you consider the signs and symptoms, drooling and some of the other things, as a caregiver, it's important just not to say anything about it, but just take care of it or make it as easy for that person as possible.
Yes.
Some of the medical treatments for Parkinson's syndrome as a doctor may include what kinds of things, Jan?
The evaluation and follow-up of the Parkinson's physician, who usually is a neurologist, a physician who cares for a large number of Parkinson's clients is someone that you want this patient to see. There will be medications, and it's very important those meds be given on time as directed. Therapy, physical therapy, speech therapy, occupational therapy to keep them active and in control as long as possible. Often a psychiatric evaluation is necessary.
Mm-hmm. In caring for the resident with Parkinson's syndrome, it is important to report the following changes to the person in charge at the CBRF. Tremors, tightness of muscles, stooped posture, shuffling walk, difficulty in starting to walk and difficulty in stopping to walk, drooling, loss of bladder control, difficulty swallowing, slurred speech, a monotone speech, voice, balance and coordination problems, the mask-like look to the face, increase in appetite, and the emotional ups and downs, oily, moist skin, and loss of appetite. Assist the resident with ADLs as needed, but allow them to do what they are able to. Administer medication as doctor orders. Follow diet as doctor orders. Provide a regular exercise activity program as tolerated. Provide adequate rest and rest periods. Maintain good skin care. Provide mental health support as needed. Cut up foods as needed. Be alert to choking. And assist residents with devices again, such as canes, walkers, the spoons and forks with larger handles, plate guards, etc. Now we're going to talk about excess disability. When a resident has more than one condition, illness or disease or injury at one time, this is called excess disability. Jan, could you explain that a little farther, please?
It's possible for a patient to have normal aging, their body is aging very normally, but for them to have Alzheimer's disease and maybe depression or urinary tract infections. You can add a fall on a slippery floor, stumbling over a threshold, and then you have a fractured hip. Other common conditions that would occur that are not normal aging but very commonly occur even with these other things are diabetes and untreated vision or hearing impairments. It's conceivable that a client would have all of these things, and you can understand the complexity then of the observations that have to be done and the medication control that has to be maintained while you're caring for them.
And it's important as a caregiver to know that you can make a difference. It's important to the resident to know or have that feeling of support from you. It's important to know when you consider conditions, not to say it's just their dementia.
Or just their old age.
Maintaining a safe environment for the resident with conditions related to aging. With any condition related to aging, it is important to maintain the safest environment as possible for the resident. To maintain a safe environment, remove clutter from all living areas. Have night lights in hard-to-see areas. Have sufficient lighting in all areas. Prevent glare by pulling shades, using non-glare lighting, and non-wax surfaces. Clearly mark stairs and remind residents to use handrails. Remove all throw rugs. Make sure all thresholds do not cause tripping. Keep commonly used objects within residents' reach. Provide grab bars in the bathrooms. Provide raised toilet seats. Room location near commonly used areas is a good idea, like the bathroom or the kitchen. Monitor residents' tolerance to outdoor heat or humidity. Provide adequate heat, temperature, humidity indoors. Provide adequate ventilation, circulation of room air. Using a fan, open the windows and doors when appropriate outside. Maintain recommended safety precautions when oxygen is in use. And monitor the residents' activity exercise tolerance. Now, turn off the videotape and complete the Part 3 conditions related to aging post-test in your workbook. Part 3, conditions related to aging post-test responses. 1. It is important to maintain a safe environment for residents that have poor eyesight, such as cataracts, glaucoma, and macular degeneration. True. Residents with these eye conditions will not see as clearly and will need the caregivers to keep their environment safe for them.
Number 2, the resident with arthritis should be kept as inactive as possible so as not to increase the pain and inflammation in their joints. This is false. The resident with arthritis should always maintain a regular, moderate exercise program to maintain their functioning level and to keep their joints from becoming stiff.
3. Stress, being overweight, and an improper diet can all contribute to heart conditions. That is true. All of these can contribute to one form of heart disease or another.
Number 4, when a resident has shortness of breath and swelling of the feet and ankles, this should be reported to the person in charge at the CBRF. True. These could be signs and symptoms of congestive heart failure, and they need to be reported to the person in charge at the CBRF.
5. Having high blood pressure cannot cause a resident to have a stroke. That is false. High blood pressure is only one of the many signs of an impending stroke.
Number 6, signs of a stroke could be sudden confusion or dizziness. True. Sudden confusion and mild dizziness could be a sign that a resident is having a CVA or a cerebral vascular accident.
7. It is normal for residents with diabetes to have a fruity odor to their breath and urine at times. That is false. Whenever a resident is noted to have fruity smelling breath and or urine, this is a sign that the resident's body is overloaded with sugar. This needs to be reported immediately.
Number 8, Parkinson's disease is a disease that can cause a person to lose their balance and have tremors or shaking of their hands. True. A resident that has Parkinson's disease should see a doctor that treats diseases of the nervous system. A doctor that treats diseases of the nervous system is a neurologist. A neurologist can best regulate the delicate balance of the medication that is prescribed for a resident with Parkinson's disease.
Now turn off the videotape and complete the Part 3 conditions related to aging quiz or activity in your workbook. Responses to Part 3 conditions related to aging quiz activity. Across. 1. An increase in the pressure in the fluid of the eye is glaucoma. 2. Across, high blood pressure or hypertension is the answer. 3. A disorder of the pancreas that causes improper use of the body's carbohydrates. That's diabetes. 4. A thick, hard film of cloudiness that forms on the lens of the eyes. Cataract.
The answer is down. Number 1, an inflammation of the joints is arthritis. Number 2, inadequate pumping of the heart is congestive heart failure. Number 3, damage or breakdown of the arteries of the eye is macular degeneration. Number 4, a sudden stopping of the blood flow to the brain is a cerebral vascular accident. Number 5, a syndrome caused by a lack of a chemical that is found in the brain is Parkinson's syndrome.
Thank you, Jan, for joining us. It's been fun.
Thanks, Millie.
And to you, the caregiver, thank you for joining us. Goodbye.